Learn 6 things today about the heart. The heart perfuses the left ventricle during diastole, and that's because when the left ventricle squeezes, it compresses the coronary arteries, making it so that blood can't flow through there. However, pressures are much lower in the right ventricle, so the right ventricle is actually perfusing itself during systole and diastole. In somewhere between 60 to 70% of the population, the right coronary artery delivers blood to the right ventricle, the inferior aspect of the left ventricle, and the posterior aspect of the left ventricle. Somewhere between 30 to 40% of the population are left dominant, so the inferior aspect of the left ventricle and the posterior aspect of the left ventricle are fed by the left circumflex artery, which comes off of the left coronary artery. A small, lucky percentage of the population actually has circulation between the right and left coronary arteries. Every cardiac muscle cell is capable of being a pacemaker. They all have a property called automaticity, which allows them to generate an electrical impulse. However, myocytes defer to the strongest stimuli, which is why the SA node wins. A common cause of atrial fibrillation are cardiac myocytes around the area where the pulmonary artery exits the heart becoming fibrous and irritable. And this happens because of high pulmonary pressures there, causing that area of muscle to continuously be overstretched. And you see this with pathologies that cause high pulmonary pressures, like COPD. The left ventricle likes PEEP. The PEEP gives it kind of an assist in generating cardiac output. The right ventricle, however, hates PEEP because it inhibits preload. We say that the normal sinus rate is between 60 to 100, but that's not really true because 100 would be too fast for someone who's at rest, and there are plenty of people at rest that have heart rates between 50 and 60, so it's really between 50 and 90.